have Zach Goldstein, Addressing Patients' Social Needs in Healthcare Delivery.
Hi everyone, my name is Zach Goldstein, and for my first minute, I'd actually like you to turn to your neighbor and discuss this question. What are some of the top predictors of a population's lifespan? Go. Keep talking, you've got 15 seconds left. All right, let's have some folks shout out some answers. Just shout it out there. Happiness, genetics, income, smoking, lifestyle, sex, obesity, zip code. Okay, I think I've got a plant in the audience because the answer is indeed your zip code. Think about how crazy that is for a second. It's not whether you smoke or drink or whether you're obese or your genetics. It's where you live. A difference of 6 years in just a couple of miles. Crazy. It's widely recognized that 2/3 of a patient's health is actually driven by social and economic factors. Highlighted just last week by the AAP, who now recommends universal screening for food because hungry kids are sicker. The good news is we're no longer debating the connection between unmet social needs and poor health. And we're amassing proof points that show it is indeed possible to address these issues. At my organization, Health Leads, we enable doctors to prescribe food and heat and housing just like they do medication. We arm a well-trained workforce with a robust technology platform to fill these prescriptions by connecting patients to local community resources. And there's growing evidence of the impact of this work. So recently a study just came out at Mass General showing that by addressing patients' unmet social needs, you drive down blood pressure and cholesterol to levels that are greater than what's required by the FDA for a new drug. And patients are far more likely to recommend their clinic as a result of offering these services. But despite all this momentum and clear ROI, not a single system in our country has yet made addressing patients' social needs a standard of care. How is that possible? I mean, how is it possible that we can track clinical needs to such a detailed level? ICD-10 has codes like burn due to water skis on fire. I mean, yeah, how does that even happen, right? And yet when it comes to a patient's social needs, we settle for the generic, they're poor or they're on Medicaid. What would it look like for our health systems to know a patient's social needs so well, we could track them to the same level of detail that we do their water skiing accident? There are over 70 million patients out there on Medicaid, along with countless others who may have unmet social needs. And yet, even at Health Leads, where I work, where our sole purpose is to remove these barriers to health, there is a huge gap between what's actually needed and the number of patients we serve today. So what do we do about this disconnect? How do we change the healthcare system so it doesn't just manage disease, but actually gets our patients healthy? First, we've got to change the definition. So in our current lexicon, a patient with missed appointments and multiple hospitalizations, we call them a frequent flyer or a non-compliant patient. But what if we could change our view? What if that patient who looked like a problem was actually just somebody who had trouble affording their medication? We could consider that just one more comorbidity, just as real as the ones that cause physical pain. It's not hard to change our definition, but it is paradigm shifting. Second, we've got to change the work. By ending the practice of don't ask, don't tell, and having providers screen patients for social needs. by navigating to community resources, referring to food just like we refer to cardiology, by establishing partnerships with local community organizations and knowing where we send our patients and that they'll receive quality care, and by tracking data because you can't improve what you don't measure. This isn't about a choice between doing everything or doing nothing. It's about doing something. To start, to recognize that the old paradigm isn't working and that the healthcare system does indeed have a key role and responsibility in addressing patients' social needs. Thank you.